And now, as we hold people in power accountable, the question of just how many people in local hospitals with COVID were admitted because of COVID.
And of course, we have been trying really hard to get the numbers straight with state and county leaders. And 2 on your side's Ron Plants takes a closer look now at what is happening in some local hospitals.
Governor Hochul brought it up and requested hospitals start reporting it last week. How many incidental cases of patients testing positive for COVID while admitted for some other reason are there in hospitals around the state? She told us today statewide it's about 57% of those in hospitals not there for COVID reasons. So
diving deeper into these numbers has really been important for us to manage. It does not mean that these are empty beds. This is still a very high number of people in hospitals who need constant care, who need nurses, who need doctors, who need people to take care of them. But just to make sure that we have an expectation of what's going on with COVID cases compared to people who are testing positive but are not in the hospital because of those positive numbers.
We tried to dive deeper last week with Erie County Executive Poloncarz, who told us in his briefing last Tuesday with some certainty.
Just adding on as opposed to strictly being COVID patients for the count.
Well, we know the answer to that question, Erie County. It's approximately 90 to 92% of all COVID-19 patients actually are in a hospital for COVID-19. There is a small portion of it, less than 10%, who may be going for a procedure or were in a car accident, had a broken leg, they test them, they find out they're COVID positive.
There was no county briefing today, and we were told the county executive adjusted that count downward to 67% admitted for COVID and 33% for a non-COVID related matter in his social media Twitter accounts. Whatever the case, we decided to check with some of our local hospitals like ECMC.
Among patients who are in the hospital who are now currently identified as having COVID, about 50%, correct me if I'm wrong on these numbers, please, about 50% are coming in because either, they're really sick because of COVID, or again, they have those frailties, as you pointed out.
Correct.
The other half, though, the other 50% are incidental testing. People, maybe a car crash victim, or some kind of trauma who's coming into the ER, and then you test.
Correct.
And that's the other, so that's 50-50, a 50-50 breakdown.
Correct.
We just heard back that Catholic health hospitals report a 30% level for non-COVID conditions for admission. A Kaleida spokesman says they do not track such numbers, and we did not hear back from the state health department to determine if it is now a requirement or when reporting of such numbers actually began. Ron Plants, Channel 2 News.